final presenter, presenter number 10, is a company called MedaCheck. This is a company that we've been working with for probably the last 3 years. They have an exciting product in probably what I would call a very growing marketplace. Elder care is an issue in this country and worldwide, and medical adherence is also something that's very, very important. And when you combine the two, I think MedaCheck is here to help that situation greatly. Jeff Shepard, who is to my left, is the CEO and has had a great ear to the ground on what's going on within his marketplace. Strong development team, good product, quality team, great advisors. And I look forward to hearing Jeff tell us the story of MedaCheck. Welcome, Jeff.
Thank you. Great, thank you. Well, good morning, everyone. I just want to say this is such an amazing event. Just hats off to all the people at HCDC. This is something that I couldn't even imagine could have been put together in such a short period of time. So great work, Pat and team. Today I'm going to talk about MedaCheck. My name's Jeffrey Shepard. We started this company in 2002 in the summer as part of an innovation program here in Cincinnati, Ohio. And really the design of the product originally was simple. I take multiple medications on a daily basis and forgot to basically take my medication, something that happens quite common obviously, and decided, wouldn't it be great if there was an app for that? And that's where it all began. So with a small $20,000 seed fund, we started the company with the sole purpose really of just determining whether we could really take a dent in the biggest problem in healthcare today, which is medication adherence. What we found fascinating very quickly though was the most important problem wasn't people like me. At the time I was in my mid-30s, pretty good health. The problem was people that were over the age of 70 years old. And what we found very quickly was those individuals weren't using technology. They didn't have smartphones, they weren't using tablets, they weren't connected. So what we did in the last 3 years, really what we've been doing is developing a product to help those individuals. So what is MedaCheck? It's a progressive reminder system. I'm going to show you that in a second. We partner with many healthcare organizations here locally. So Mercy, Christ Hospital, Children's Hospital locally, as well as others nationally. We have an amazing leadership team. Probably the one thing I'm most proud of at MedaCheck is the team that we've built to solve what I believe is the toughest problem in healthcare today. We have a customized platform, and really this is the differentiator from our product and the other 50 apps that are in the market. We do everything we do is cloud-based. So we collect all that data, and that has become a very powerful part of our business. I know we've done show of hands today, but we're going to do one more, I promise, just one. Show of hands, who takes a medication daily? Could be a medication supplement. Okay, so probably about half of you. Well, that's about right. About half the United States is taking at least one pill a day. 33% of Americans are taking more than one pill a day. I fall in that category. Anybody else? Okay, great. So I think if we look at medication adherence as a $360 billion problem, that's billion, this is how it's made up. It starts with people forgetting to take their medication as prescribed by doctor, having some sort of a medical incident, ending up in the hospital, and then your average hospital stay is almost $26,000. So that number, we can get to that 360 billion very quickly. I think what's really interesting though is, and I'm just going to focus on medication adherence, when people are prescribed a medication from their physician, they'll leave the doctor's office, and 12% of those people on the way between their house or between the physician's office and the pharmacy forget to even fill the prescription. They don't even bother. From those, only a quarter of those folks don't even take it for the first 10 days. Is anybody guilty of that? I know I said no more show of hands. I know I've been guilty. And then at the end of the first month, only half the people are taking that medication as prescribed by doctors. So that's a big problem, and that's how we get to 360 billion. What have we built? We've built a product that doesn't let you forget. I'll show you how it works. And we call this a progressive reminder system. And how it works is we've developed a 7-inch tablet. All this tablet does is remind you to take your medication and tell you what time and day it is. It does nothing more than that. We found that seniors particularly love this device for its simplicity. When it's time to take your medication, the device beeps, brings up Nurse Nancy here. She'll tell you it's time to take your medication. You touch the screen. We have a high-resolution picture of the medication itself. Give you the option just to take or skip. And I would bet even the people in the back of the room could see how big the buttons are. And the reason we do this is because individuals over the age of 75 years old have a hard time seeing in some cases. We can do all sorts of things with this device. We can send multiple medication alerts. We can do things like check your weight utilizing Bluetooth scales. We can also do things like tell you to refill your prescription, which has become very popular. I think what's more interesting, though, about the way we've designed our product is what's called progressive reminder. So I just showed you how the actual device works. Let me tell you what happens if you pay no attention to the device. Within an hour of your device going off, we will call you. We have a call center based out of Salt Lake City. They'll call you. If they can't get in touch with you, they're going to call one of your family members. They could even call your physician or loved one. So we call that progressive reminder. So what we've done with that is we go back to that mid-40s adherence rate as a country, and we have increased it. On patients on MedaCheck are over 86% adherent. And that's something that's pretty incredible if anybody studies adherence in the crowd. When we started the company, a physician told me, I'll do jumping jacks if you can bring it up 10 points. I have them doing backflips now. Target markets, and there's a lot of them, right? Hospitals, pharmaceuticals, personal emergency response devices, the I've fallen, I can't get up people. They're great. They do a fantastic job at selling our product. Accountable care organizations, we sell directly to the consumers through a dealer network. We're also very involved in selling to long-term care pharmacies. And in the United States, there's over 2,000 of them. I think what's most incredible, though, about our company, we've built a great product. Our technology is wonderful, but we have an amazing team. And this team alone, as you can see, our 4 senior leaders. And when I was sitting in the back looking at this, I recognized that of these 4, there's over $250 million in exits. So that's pretty incredible. What are we doing now? Well, probably the most exciting thing is we've now done something that we've been trying to do from the very beginning, 2012, get Medicare to pay for it. So now, in the state of Indiana, the Medicaid voucher program, or Medicaid waiver program, I'm sorry, is now paying up to $1,000 a year for MedaCheck. And this was something that we thought could never happen. With this, and looking at the 14 other states that are a part of this program, we've recognized we can grow the company now and really start to scale the product. We have great partnerships with organizations like Verizon, Mercy, Christ Hospital, Children's Hospital, all local, as well as many more nationally. As any startup here today, we're always looking for money. So if there's any investors in the group today, I'll be standing back at the table. We'd love to talk to you. Thank you so much for having me, and have a great rest of the day.